Hey friends, welcome back to the channel. Today I want to share with you how you can earn an income of $300,000 or more as an RVU-based primary care physician. Now, primary care does not have to be associated with a lower income compared to the other medical specialties. It is very much possible for an RVU-based primary care physician to earn a top-tier income. Now, as an RVU-based primary care physician myself, one of the biggest challenges I faced was knowing practically what it is I can actually do to maximize my RVU productivity and income, especially so when I started out as a new attending. I remember one advice I received from my colleagues was that I needed to see more patients, but I eventually learned the hard way that this is probably one of the worst pieces of advice. Now, I'll get into that in another video. But the average primary care physician salary is typically between $200,000 to $300,000. But if you remember when going through your job interviews, the recruiters would always say, oh, the top 20% of our providers are actually earning above $300,000. But how do we actually do that? So in this video, I want to give you 3 practical strategies you can actually use to scale your work RVUs and maximize your income to earn above $300,000. So starting with number 1, get your volume up. Because in order to bill for enough services to maximize your RVU productivity, you do have to get your volume up. Now, one of the biggest things that I teach in my RVU consulting program is that you do not need to see a crazy volume of patients in order to earn a top-tier income. There are other strategies that are part of the scaling work RVUs equation that also play massive roles. Now, if you're interested in learning more about these strategies, I've included a link to my RVU consulting program down below if you want to check that out. I've also included a link to a free training video if you want to check that out as well. So I'm not going to sit here and tell you that you need to see 30, 40, 50 or 60 patients a day in order to earn a top-tier income. You certainly can if you want to, but you do not need to. Once you determine what your desired salary is and know the annual work RVUs needed to reach that compensation goals, then you can use that as a guide to figure out how many patients you need to see a day in order to reach that goal. The number 2 strategy is mastering billing and coding. Now, I know I touched on this topic in the previous video, but I cannot stress enough the importance of understanding how to properly bill and code. As I mentioned in the previous video, this is hands down one of the main strategies that I implemented in my work to be able to scale my work RVU productivity and significantly maximize my compensation. I know this topic is not the most fun and some providers just downright hate it, but if you are an RVU-based primary care physician that wants to break through their income ceiling, you simply cannot avoid understanding billing and coding. Again, I am not saying that you have to become a billing and coding specialist, but you do need to understand enough as a physician to be able to bill and code better so that way you're not leaving any money on the table. There is no point in working hard and providing great care to your patients to only then undervalue yourself when it comes time for billing. So for example, something as simple as fully understanding the different levels of service and billing appropriately based on the work that you've done will significantly scale your work RVUs without doing anything else. Now, I know some providers out there say that, oh, the RVU system just leads to a lot of billing. I want to comment on this in 2 parts. First, work RVUs are only tied to CPT codes. I mentioned this in the previous video as well. Work RVUs are only tied to CPT codes, meaning that the CPT codes associated with the services that you bill for have work RVUs. So you do have to bill for services in order to generate work RVUs. You can't avoid that. But the second part to that comment is that this, however, does not mean that you have to order random evaluations or order random treatment plans just to be able to bill higher. And certainly do not bill for services that you have not done. This is wrong. Your number 1 focus should always be the patient. When you focus on the patient, everything else will fall in place, including RVU production. So practice appropriately and everything else will fall in place. The third practical strategy is having a return policy. When you're working towards maximizing work RVUs and income, it is very important to discuss specific follow-up instructions with your patients. Your patients should know in advance the specific follow-up required for certain conditions or certain medications, because while ensuring proper care to your patients, which again is always going to be the number 1 focus, you must maintain a steady flow of volume, which in turn leads to maximizing RVU production. If this was interesting to you and you'd like to hear more valuable information like this, then consider subscribing because I do post a video like this every single week, doing my best to help RVU-based primary care physicians scale their work RVUs and maximize their income without overworking or burning out. Again, the link to my RVU consulting program is down below if you want to check that out, as is the link to a free training video if you want to check that out as well. Make sure to leave a like and share this video with your colleagues. I'll see you next time.